Hello, my name is Claire Betch. I will be discussing the history and education of nurse anesthesia. I chose this topic because it is a specialty that interested me a great deal and I wanted to learn more about it. As I complete my nursing education, I will consider it as a possible specialty area of practice. Background. The first public demonstration of anesthesia during surgery was performed by dentist William Morton in 1846 using ether. However, anesthesia was not commonly used in surgery for another 50 years because it was associated with many dangers, including a high mortality rate, high risk of aspiration and asphyxiation, as well as no way to monitor complications such as hypotension, cardiac arrhythmia, and other complications. Frequently, the administration of anesthetics was left to medical students, nurses, and orderlies, none of whom had received any formal education in anesthetic procedures. Once the public became aware of the advantages of anesthesia during surgical procedures, it was in higher demand and more elective procedures took place. Many physicians felt the role of administering anesthesia was beneath them, and they were more interested in learning the skills and techniques to become surgeons. The surgeons were interested in finding well-educated professionals to deliver anesthesia because they were unable to find physicians to fill this role. They turned to graduate nurses. Nursing as a profession was undergoing quite a few changes of its own. Their role was no longer simply to provide comfort, food, and a clean environment, but also knowledge and application of scientific principles to guide their practice. Nurses assumed duties and once limited to physicians, including administering anesthesia. Some of the pioneers of nurse anesthesia include Catherine Lawrence. She is credited as being the first nurse to administer anesthesia during the Civil War. She administered chloroform to wounded soldiers in need of emergency surgery in the battlefield. Surgeons took note of the valuable service Catherine and others provided and began training more nurses to take on this important job. Nurses were felt to be ideal for this practice, as the opinion was they would be satisfied being subordinate to the surgeon, would be able to focus their practice, and develop a high level of skill to provide smooth anesthesia required by the surgeon. It was at this time that nurse anesthesia began to be known as its own separate profession. Nuns were very important in the training and practice of nurses and also nurse anesthetists. Sister Mary Bernard Sheridan was the earliest recorded nurse to specialize in anesthesia. She worked in Pennsylvania Hospital in the late 1870s and was very influential in training many other nuns who were nurses in the Midwest to deliver anesthesia. Alice McGaw came to St. Mary's Hospital, Minnesota in 1893 and began working as a nurse anesthetist under Charles Mayo, who called her the mother of anesthesia because of her aptitude and ability to deliver safe anesthesia to his patients. She documented and evaluated all of her patients and procedures, outlining her techniques, discussing the importance of assessing each patient preoperatively to determine the specific needs of each patient, what was required for the surgical procedure, and the working relationship between the surgeon and the anesthetist. She discussed identifying the temperament of the patient, the need to gain their confidence, and prepare them for what to expect, while tailoring the anesthetic to each patient's tolerance. Her work highlighted the benefits of proper training of the nurse anesthetist. Initial roadblocks. In the early 1900s, the practice of nurse anesthesia experienced resistance from physicians who felt this was the role to be carried out solely by physicians. Dr. McMeacham filed a complaint with the Ohio Medical Board, and the state attorney general ruled in 1960 that only registered physicians could administer anesthesia. Surgeons initially abided by the ruling and then successfully lobbied that state legislature with an exemption that nurses that had been educated properly could administer anesthesia under the supervision of a physician. In Kentucky, in the following year, the Louisville Society of Anesthetists suggested to the state attorney general that only people who had medical knowledge and training should administer anesthesia. Individual surgeons and hospitals who did not support this were expelled from the society if they used nurse anesthetists. Dr. Louis Frank and his anesthetist, Margaret Hatfield, filed a suit appealing this ruling and won. An important aspect in the discussion of nurse anesthesia is the development of anesthesia techniques over time. Dr. Morton was searching for a better agent than what he and other dentists had been using for many years, nitrous oxide. He determined that ether gas inhaled in the proper dose provided a safe and effective anesthesia. Chloroform was also used successfully during this time. Pediatrician Joseph O'Dwyer developed an endotracheal airway that was metal to deliver the gas, and he would insert this blindly into the trachea. Further improvements made to the tube were the addition of a cuff that would anchor and allow for positive pressure ventilation of the anesthetic gases. The invention of a handheld laryngoscope for direct visualization of the airway and placement of the tube helped a great deal. Additional techniques utilized by nurse anesthetists included intravenous medications such as barbiturates and opioids like sodium thiopental and morphine. Many other drugs were tried, but it was the discovery of propofol, which had a short recovery period and suppressed laryngeal reflexes, that proved very beneficial as an anesthetic and is still used today. Neuromuscular blocking agents were used to provide muscle relaxation that is needed during some surgeries and also to assist with intubation. It provided a benefit, especially during thoracic and abdominal surgeries. These medications were derived from the curare plant. Regional and local anesthetics act in a contained area and can prevent the need for deeper anesthesia states, such as those seen in general anesthesia. The educational preparation of nurse anesthetists around the beginning of the 20th century included a nurse anesthesia school formed in 1909 by Agnes McGee at St. Vincent's Hospital in Portland, Oregon. The course was 7 months long and included courses in anatomy, physiology, and pharmacology, and the administration of the few anesthetic agents that were available at the time. Within the next 10 years, approximately 19 schools for nurse anesthesia had opened. These all consisted of postgraduate anesthesia training for nurses who had completed their general nurse training, and they were about 6 months in length. The hospitals that hosted these programs included Mayo Clinic, Johns Hopkins Hospital, Barnes Hospital, Charity Hospital in New Orleans, and Grace Hospital in Detroit. In the early days of administering these anesthetics, the knowledge and available anesthetic options were extremely limited, and programs provided what little education they could. The educational preparation of future nurse anesthetists is a much more lengthy and intensive process than it was in the past. Current nurses who wish to receive a degree in nurse anesthesia must have their Bachelor of Science in Nursing, have passed the NCLEX to be registered nurses, gain 1 year at least of critical care experience, and then may apply to nurse anesthesia school. It was in 1981 that guidelines for a master's prepared program were developed. In 1982, the American Association of Nurse Anesthetists Board of Directors determined the applicants should have their bachelor's and that educational programs for nurse anesthesia should be at the master's level. Currently, in 2007, the American Association of Nurse Anesthesia supported doctoral level preparation as entry-level practice for nurse anesthetists, with a target date of 2025 for all schools of nurse anesthesia to abide. Current practitioners who have their bachelor's or master's degree would be grandfathered in. Nurse anesthesia programs at the doctoral level are approximately 36 months long, and then nurses are eligible to sit for a certification board exam, after which they pass and are able to use the credentials Certified Registered Nurse Anesthetist, or CRNA. References were used as citations within this work and guided my research on the topic. Thank you for listening.